Welcome again to the Dr. Ridwan Show, Health Information You Can Use. In today's episode, we continue to learn about low testosterone and its treatment, and with our great guest experts, Dr. Ajay Nehra and Dr. Matt Rosenberg. So, how is the diagnosis in the doctor's office made of low testosterone? Explain to us what happens in the doctor's office when a patient presents to you that might have low testosterone, and how you arrive and reach the diagnosis.
Well, the patient will present with symptoms. I mean, that's been the classic way, but we're trying to get people to think a little bit out of the box and realizing that there are other symptoms other than just the sexual issues that we discussed in an earlier section. Now, once we have reason to draw a level, we're going to get a testosterone, and we prefer to get that in the morning. And the reason for that is that's when testosterone is the highest. Now, it's actually, testosterone comes out in a pulsatile nature, and it kind of goes up and down during the day several times, but it's highest during the morning. And because of the fact that it goes up and down during the day, an initial low testosterone should be double checked to make sure that it's truly low and we just didn't catch it at a low point.
So, in other words, the diagnosis starts with suspicion of the diagnosis in a certain patient with the symptoms of low testosterone that we explained earlier, and then a blood test is done for testosterone, and that blood test is best done in the morning.
It's together with the signs and symptoms, the evaluation and diagnosis by the blood test, that one comes to a conclusive evidence if you are at a normal range, if you're at a low range, and above all, at times, if you're at an equivocal range where you have signs and symptoms, but the blood test is just about near normal, and it becomes a issue that needs to be addressed and discussed between the physician and the patient about management of therapy.
Sure.
The viewers and the audience of our show submit questions, and I'm going to ask you some of the frequently asked questions about low T or low testosterone. There are actually 3 frequently asked questions about this that we receive frequently on our website, www.drridwan.com. And that the first question is the testosterone level as measured by the blood test the same throughout life? In other words, are the so-called normal ranges the same in early age, in middle age, in late age, or are there differences? What does the science say about that?
That's a tough question because there isn't a lot of great data on that. We know that testosterone goes down as we get older, but the ranges all stay about the same. So we don't have age-related ranges at this time.
So what is considered a low testosterone? What is considered a normal testosterone? What is the number?
That's a good question again, Dr. Shopsik, and clearly what most of us in referenced labs, every reference lab has their own cutoff. Traditionally, the FDA,
which is the Food and Drug
Administration, they've used a number of about 300.
300, that is 300
nanograms per deciliter. And clearly, if you are in some labs where the cutoff is 250, you need to understand that that is 250. So the physician who's getting the blood test addressed will certainly know that number. But it's safe to say a value of 300 is a right way to approach further course of management.
Mm-hmm. No, that's a great point. A good example of that, I just had a patient this week who came in. My reference lab is 250. So the patient came in at 270 twice.
And how did you advise that patient?
It was tough. I said, you've got the signs and symptoms. He had some other issues. He actually was a diabetic and he had a heart attack at one point. So I'm like, this would be a reason to check, and that's why I did. And I checked, and it was equivocal. And we went over the risks and benefits of what I was thinking, of what the lab showed, and what my goals were in treatment. And at the end of the day, we decided to initiate therapy, but as long as he was in agreement with me, and I was in agreement with him, which we were.
And actually, what you just mentioned is addressing one of our frequently asked questions on our website, by our viewers, which is the so-called low normal testosterone or borderline testosterone. Many of our viewers ask the question through the website, what is borderline testosterone? My testosterone is low normal. Is that worth treatment or not? And I think you addressed some of that through conversing with your doctor. You can actually get that issue resolved, and by addressing the benefit risk of treating such a patient.
You used a very important word there, which is conversing with the patient. You know, this is so important for us in all disease states, and especially in this disease states where the science is still evolving. Sit down, after you have a diagnosis, educate the patient. Have a conversation with them of, this is what's going on, this is why I'm thinking this way, and these are what our options are.
The other question that frequently comes up on our website is the question of the so-called different types of testosterone. We have some of the viewers ask us about something called total testosterone, free testosterone. There might be a little confusion in that. What can we advise?
I think it's fair to say, again, a conversation with the physician is extremely important. Every blood test that's valued needs to be individualized for that particular patient, as Dr. Rosenberg alluded to, at least on 2 consecutive blood draws. Having said this, it's important to understand that you have a total testosterone and a total testosterone range. Additionally, there may be a free component or a bioavailable component. That's very important. And it may be a reflection of one's body habitus. If they are obese, whether, as we talked about in an earlier segment, if their waistline is quite a lot, well, it may affect the availability of that bioavailable testosterone. So that's why we talked about individualizing a blood test for that specific patient. And to summarize, a blood test just doesn't fit everyone across the board. Dr. Rosenberg alluded to the fact that various age decades may have, in general, similar, but there are changes that progress over a period of time. So that's really what we need to engage and dialogue with the patients.
There's something that I've described to the patients about how we look at testosterone. And just as was mentioned, we have the free testosterone. Then we have other testosterone that's bound to different things in the bloodstream. And we talk about one being sex hormone binding globulin and the other being albumin. Now, the patients aren't going to really care the difference between that. But the albumin, it's a loose tie. So that testosterone can still affect the patient. When it's bound to that sex hormone binding globulin, which changes depending on the comorbidities of the patient, that testosterone...
I mean, the other diseases that
the other diseases, exactly. Yeah. That testosterone is not going to be free. So in the equivocal case, in that borderline case, we need to figure out, is there one component over another that's affecting how much testosterone can actually be used by the patient? And again, this is why clinicians need to have the discussion. It's not a black and white number. Yes, you treat here. No, you don't treat here. It has to have a discussion along with it.
And the good news for our viewers is that making the diagnosis of low testosterone is fairly simple. It's not that complicated in the majority of patients. Patients Absolutely. Who have the symptoms that make the patient and the clinician suspect having hypogonadism in that particular individual requires a blood test. The blood test that we start with is the total testosterone twice in the morning on 2 different days, and then if that number is lower than the particular lab lower number of the norm, or if it is generally below 300 nanogram per deciliter, then we have a diagnosis of low testosterone and hypogonadism. And in certain small number of men, there might be need for additional blood tests. There might be need for even other tests other than blood tests, and these are specialized cases. But generally, to remember, the diagnosis is fairly easy and fairly simple, and really men who have the symptoms need to pay attention to this. Stay with us. in the Dr. Ridwan Show, health information you can use. We will continue to talk about testosterone deficiency, and in the next segment about how we treat low testosterone. Stay on www.drridwan.com.